In this lecture, I will discuss the foramina of the cranial base superior opening, superior view. Foramina, what is foramina? It is the opening of the cranial base. Where are the foramina present in the cranial base? Have superior view. First we have labels. There are 12 labels. Then we have a clinical point of view. First label you can see here, this is the foramina of cribriform plate. This is the foramina of cribriform plate. Here is the olfactory nerve bundles present. Second, this is the orbital canal. From the orbital canal, this is the optic canal. From the optic canal, optic nerve, that is cranial nerve second, and ophthalmic artery pass. From the third label, you can see here near to the second, this is the superior orbital fissure. This is the superior orbital fissure where the oculomotor nerve, cranial nerve 3, trochlear nerve, cranial nerve 5, lacrimal, frontal and nasociliary branches of ophthalmic nerve pass, that is of cranial nerve 5, and the abducent nerve, cranial nerve 6, and the superior ophthalmic veins pass. First we have a foramina of cribriform plate where the olfactory nerve, that is the cranial nerve 1, and the second label is the optic canal where the optic nerve pass, and the third is the superior orbital fissure where the cranial nerve 3, 4, 5, 6 passes, and the fourth one we have a foramen rotundum where the maxillary nerve, second branch of cranial nerve, fifth pass. This is the foramen rotundum, fourth, and the fifth one is of oval shape. It is the foramen ovule. You can see here, this is of oval shape. This is the foramen ovule where the mandibular nerve pass accessory meningeal artery and the lateral petrosal nerve. The main thing is the mandibular nerve, that is of cranial nerve 5th branch 3. The 6th near to the 5th is the foramen spinosum where the middle meningeal artery and nerve pass, and the meningeal branch of mandibular nerve where the middle meningeal artery pass. 6. 7th is a large foramen. This is the foramen lacerum. This is the larger than others. This is the foramen lacerum. And the 8th we have a carotid canal. From the carotid canal, due to its name, internal carotid artery, internal carotid nerves means neurovascular bundles pass from the carotid canal. And the 9th one you can see is the internal acoustic meatus where the facial nerve, cranial nerve 7, vestibulocochlear nerve, cranial nerve 8, and labyrinthine arteries pass. Internal acoustic meatus for the air. And the 10th you can see here is the jugular foramen. 10th is the jugular foramen where the inferior petrosal sinus, glossopharyngeal nerve, that is cranial nerve 9th, vagus cranial nerve 10, and the accessory cranial nerve 11, sigmoid sinus and posterior meningeal artery pass. From the jugular foramen, cranial nerve 9, 10 and 11 pass. Easy to remember. And the label 11, hypoglossal canal. From the name hypoglossal canal, hypoglossal nerve is passed, that is of last cranial nerve, that is the cranial nerve 12. And the 12 foramen you can see here is of big size. It is the foramen magnum, and in the previous lecture we will discuss from the foramen magnum, medulla oblongata, meninges, vertebral artery, spinal cord starts, spinal cord continue from here downward. So discuss this, review them in detail. I will do it. First we have a foramina of cribriform plate. It is the olfactory nerve bundles. Second we have a optic canal, and the third superior orbital fissure. Fourth, we have a foramen rotundum. Fifth is of oval shape, it is the foramen ovule. Sixth, we have a foramen spinosum. Seventh is foramen lacerum. Eighth, we have a internal carotid canal, and the ninth is the internal acoustic meatus. 10th is the jugular foramen. 11th is the hypoglossus canal, and the 12th is the foramen magnum. These are the foramen, note them and remember them, these are very important. And next we have a clinical. In the clinical we will discuss the fracture are trauma involving any of these foramina may result in a clinical sign and symptoms associated with the neurovascular elements passing through the foramen. If the nerve or neurovascular bundles that performing a specific functions, any injury or trauma to these nerves can lose its function. Thus, it is important to know these structures and their relationship to the cranial base. In this lecture, I will discuss the foraminas and their clinicals. I hope so you like this video. If you don't understand, repeat this again and again. Thank you.